Passing Obamacare cost Democrats control of the House in 2010, and President Obama's failure to implement his own signature legislation may reduce the Democrats' chances of winning back the House from slim to none. I'm Steve Green. This is Trifecta, and let's bring on Bill Whittle and Scott Ott right away and get into this. Now, gents, according to a report from the Hill's Sam Baker, Democrats are the ones complaining about the Obama administration's one-year delay, and it may go longer, in implementing one of the ACA's most popular provisions, or it would be popular if they ever get around to making it happen. As a result, small business won't have the multiple health care plans to choose from their employees. Nobody knows what they're going to be left with. Now, Bill, who would have guessed that the federal government could spend billions of dollars across multiple agencies, requiring establishing data swapping between multiple levels of government amongst all 50 states to provide a long-promised service and still not be able to put up a website?
I could have guessed it.
Yeah, we all did, didn't we?
I think I'm done. This is one of many, many, many catastrophes in this bill. Look, I'm loving watching this. I am, because I think really the only hope for the country after having reelected Barack Obama is to feel the pain of having elected Barack Obama, so that Barack Obama, while he can't be reelected, but Barack Obamaism may be consigned to the dustbin of history where it belongs. There's no way to afford this program. It's a terrible program. Everything that gets bigger and bigger and bigger gets stupider and stupider and stupider. The answer is to go in the exact opposite direction, to make it smaller, more local, more nimble, more diverse, more dispersed. They'll learn the hard way, and the hard way is just now beginning.
Reality. Every time. All right, Scott, Senator Mary Landrieu, I can speak her name, the Louisiana Democrat, she told the New York Times the delay, and these are her words, will prolong and exacerbate health care costs that are crippling 29 million small businesses. Now, I don't really have a question here. I just wanted to point out that Obamacare is so bad that when Democrats talk about it, Scott, they sound an awful lot like Republicans.
Well, yes, except that the only thing that would exacerbate the high cost of this situation even worse would be the immediate implementation of Obamacare. So, in a sense, right, she's correct, but it's like this is like the second worst thing that could happen. The worst thing that could happen is that they would implement it now. When we talked about this back in whenever they started introducing it and bandying it about in Congress, one of the things we talked about was, have you ever heard of a major organization rolling out a transformational, gigantic program all at once without testing it anywhere? And that's the problem. Even if you think that government has a place in doing universal health care, for example, no prototype, no testing, no model, no track record, and suddenly they think they're going to be able to roll it out all at once, changing the way everybody in a bunch of industries does everything, and there aren't going to be any bugs with that?
Well, actually, they did test it in Massachusetts, but let's just ignore the state behind that curtain. Bill, just a couple of weeks ago, 33 Senate Democrats voted, well, it was a non-binding vote, but still, they voted to repeal Obamacare's onerous tax on medical devices, which, by the way, it's a gross tax on, it's a tax on gross sales, not on profits. Anyway, it's pretty obvious to me that Obamacare won't be repealed in one fell swoop, but could it be nibbled away to nothing, just one provision like this at a time?
Boy, I sure do hope so. I hope so, and I expect so, actually, Steve. Just take the example that you just gave. You put an enormous tax on medical equipment to raise money for the government so that it can provide health care. And then what happens is the cost of that medical equipment is then built into the cost of all the care, which means it costs more money than it would otherwise to provide the health care. And so you're stuck in the giant feedback loop of perpetual failure that is the government. You take money so that you can spend money, so that you can take money so that you can spend money, when if you just got out of the taking money part and let people spend money the way they would normally spend money if they hadn't had it taken from them and then spent for them, everything would work better, much like this country used to before these miserable, low-life, low-brained, low-IQ, control-freak, genetic mutant, socialist takeover fiends got their grubby little paws on the levers of power. But America's going to pay the price for this, don't you worry. And when we watch these companies more and more often cancel insurance policies because it's cheaper to pay the penalty, then the American people will at last be able to bask in the glory of socialism and Obama and all that wonderful stuff. as they sit unemployed and uninsured and unhappy.
Wow, that was the first ever spoken word version of a Rube Goldberg machine I've ever heard. Scott, Republicans ran strongly against Obamacare in 2012, but they lost seats in the House, they lost seats in the Senate, and they didn't come anywhere near winning the White House. Why should 2014 be any different?
Well, I mean, if you're taking history as an example, 2014 won't be any different. The only possibility that there could be something different here is that if Republicans learn from the shellacking that they've taken in the past, when they try to do PowerPoint presentations and policy wonk, keynote addresses about what's happening in our government instead of connecting with where people really live. And they need to start getting down on the street level and finding out how this is affecting people. Start talking to small business people and their employees. And, the waitress who works at the diner that's trying to figure out how she's going to pay for her health care now that her employer can no longer afford to offer it to her. They need to tell those stories in a very personal way. Don't give up on your rationality, but start to cloak that rationality in some emotion, in some drama, in some human narrative that people can connect with in their minds and their hearts.
It's so crazy, it just might work. Folks, the mystery of Obamacare is that a majority of Americans want it repealed, and another majority of Americans don't think it ever will be. That should tell you just how dysfunctional our government has become, because there's something even more dysfunctional about an electorate that keeps voting for politicians who pass laws we don't like. So, America, enjoy a new and massive bureaucracy, strangled small businesses, skyrocketing premiums, reduced access to care, lost coverage, lost employment, bankrupted doctors, exploding deficits, and an emboldened and enlarged IRS. I say, let it burn. For PJTV, I'm Steve Green.